So now I would like to introduce Suzanne Wagner, who will be conducting the webinar today. She is principal and founder at Housing Innovations, a group providing consulting to organizations to develop and implement innovative solutions to homelessness. Suzanne has provided training and consultation to hundreds of nonprofit and public agencies throughout the country to expand their capacity to provide effective services and implement evidence-based practices. She has worked with numerous organizations to implement and evaluate critical time intervention, housing first, and other EPPs. Suzanne has over 30 years of experience in the design and delivery of housing programs and services for homeless people, ranging from adolescents and families to single adults with complex needs. She holds a master's degree in social work from Columbia University and a bachelor's degree from Barnard College. Suzanne, if you want to get us started.
Okay, great. Thanks, everyone. Good afternoon. It's great to be here with you. I think I don't know if it's snowing there, but if it is, hope everybody's safe. So today's webinar is about Housing First. And the way I'm going to structure it is some of you may know me, I usually have too many slides, and you'll think there's a lot of slides here. So I won't cover everything because you'll have the PowerPoint that you can refer to later, and we always like to provide some resources. But I'm going to talk about what Housing First is, what the practice is, and the components of the practice, as well as what it means to be a Housing First program if you're shelter or transitional or outreach or permanent housing, and then get into also at the end some real housing stabilization and retention strategies, including a little bit on harm reduction. So it's a lot for an hour, and I think it is material that could really be expanded, but I'm really happy to be with you all today and to be doing this. And for those of you who saw this at the conference, it'll be very similar, but always a little bit changed each time. So what is Housing First? And Housing First means a lot of different things, and that can be confusing. And how we're going to use it for today is really in the big sense of the definition, in terms of having a real shift in your system from a housing readiness approach where we keep people homeless until they meet certain markers or benchmarks or achievements in their lives, to moving everyone into housing as quickly as possible, because we know that housing improves health outcomes in every other area, and moving people into Housing First has been proven to really work with folks to maintain their housing, even people with high needs, but it really is reliant on services post-housing to support stability, and that's a really key piece. So it's not only services while people are homeless, which is where the system used to end, but it's services post-housing. One thing about Housing First, it is an EBP, which is an evidence-based practice of model of permanent supportive housing, and some of you on the line today might be implementing that model. And it's also a system-wide orientation. So as I said at the beginning, we're going to talk about what does it mean to be Housing First as a shelter or outreach or transitional, and that's an expansion of the use of the term Housing First. This image just kind of shows you the old model of housing readiness. Some of you may have been around and working in the field where people went from homeless to shelter to transitional to permanent housing. And what we had were, multiple fail points along the way. And also over the years increasing evidence that if we move people quickly into housing and then provided the supports, I don't know if you can see the mouse. I'm circling the supports, but providing support in the housing to help people stabilize. There's less chances for failure, and there's also really not been research or evidence to show that all the preparation work that we were doing really made an impact, because it really is when the rubber hits the road and someone has to comply with the lease and follow those standards that we see how they're going to do. Other programs were indeed programs and not housing, and so this is really about helping people learn how to manage a home and be a good tenant. Some of the key practices in any Housing First, whether you're just the PSH program or you're another type of program, is trying to think about housing, just like I kind of use this metaphor of the emergency room. When you show up in an emergency room and you're bleeding, they're going to look at that quickly and try to resolve it. Is, people are having a housing crisis when they're homeless. So we want to try and see it as a crisis and provide as quick of access to housing as possible while providing services with some kind of a clear path that incorporates choice. And I'll talk more about choice in this process later. I know Housing First is about moving people into housing quickly, but if we don't understand what people's choices are and how they can and can't be accommodated and really work that through with them, we do know that results in less successful housing outcomes for people. Housing First is also a key practice to be low barrier, but as I like to say, low barrier but high expectations. So we don't have a lot of requirements in terms of entry beyond that people meet standard behavioral expectations, follow basic rules and norms of this, and that they can be maintained safely in the program. But we have high expectations that people's lives can be better. And Housing First isn't housing only, and it is about connecting people both to housing as well as their goals that relate to having stable housing and how stable housing can help someone get a job or reunite with family or perhaps treat their medical conditions and live better and longer inside as opposed to while they're homeless. But it is high expectations in the sense of we believe that people can do well and that continued stay in any program, no matter what the model is contingent on meeting these basic behavioral expectations or a lease or something that looks like a lease, an occupancy agreement, because we want to start teaching people how to live in the real world, as it were. Housing First really uses harm reduction wherever we can, and I'm going to talk a little bit more about that later. Some of you may know that as a treatment approach for substance use, but it also can be used to apply to a lot of other behaviors that put people's housing at risk. In Housing First, some models actually, like in the permanent supportive housing model, the option to engage in services is voluntary for the person, and that's certainly promoted on the federal policy level, is that services are voluntary. But whether services are required or they're voluntary, the onus is on staff to use assertive engagement to make services attractive to people, in other words, that they meet their needs, and engage them in services. And so if people are saying, I don't need you, I don't want you, one thing we want to make sure is they understand our role and how we can be helpful. And it's really important, and I'll talk more about role later, to be clear about how we can help, but also to really try and understand what it is that the person does need help with that fits within our role. So we're continually looking to make a match between those two things. Another key practice in Housing First is really teaching tenancy skills, teaching people how to follow a lease. And that work starts from the beginning with people as soon as we meet them, as we want to get a sense of how, and I'll talk again about this a little bit more, how much experience they have as a tenant, whether they've ever had a lease in their own names, and also making sure people are aware of their rights and their responsibilities in housing, and also how to prevent eviction and work with landlords to connect to services as well as community resources. And I'll talk more about landlords later, but we really need to partner with whoever the housing provider is. And a lot of times people may be in permanent supportive housing, and or people may be in a subsidized unit or maybe getting rapid rehousing, and so it's only a brief connection. But whoever is providing the housing and we're providing the services, and those two roles should be separate, and I'll talk a little bit more about that later. But we want to really make a connection and have the landlord enforcing the lease and us being the support to help people learn how to follow the lease. So this is one of my favorite Housing First slides, which is that, and hopefully it's clear as to you as it is to me, that Housing First is not housing only. It's not anything goes. The low barrier expectations in terms of admission doesn't mean that there aren't any expectations for folks, and they indeed can meet them, but they may need help, and that's where we come in. And that's a big part of our role, is making sure people understand what the standards are for keeping up a unit, how to do it, and have support to do it if they need it. So, usually if I'm in a room and I'm talking to people, I ask folks what's wrong with this picture. And, obviously there's a lot here, but there's a fire hazard, which is the thing that probably raises the biggest red flag in my mind. We see a big burn mark on that couch, and then of course the 10,000 cigarette butts. Maybe some health issues going on, but certainly that's another kind of violation on terms of health and safety standards in housing. The other thing I want to say about that picture is that this shouldn't be what we walk in on. Housing First is definitely being in folks' units and seeing how they're doing, and getting ahead of these kinds of things, both through teaching people how to maintain a unit, and then also if we observe things once, we never really know until someone moves into housing how they're going to be. I mean, we have some clues from how they live in the transitional housing program or shelter, maybe, about maybe whether they collect things or how they are in terms of their hygiene, but we really need to do a new assessment when people move into housing and see what they know and don't know. A lot of folks have never had their own place. Increasingly, we're serving young moms or young parents with children, and they've never had a lease or their own place, or folks who might be chronic, who maybe even though they're in their late 50s or 60s have never had their own lease and known the rules. So we want to head this off at the pass, and we certainly want to make sure we don't take things for granted. We had someone who lived in our housing program that I worked in who had a really filthy apartment, and what we learned is he had been institutionalized his whole life and never learned how to clean. And once he did learn how to clean and use cleaning products and so on, he actually became the model apartment. So we don't want to make assumptions about what people can do, but we also have a role in addressing this with the person, and that's the anything goes part of this. Somebody needs to enforce the lease. That is a standard part of Housing First. That should generally be separate from the support services provider. And even if the same agency providing both things, you might want to, and you really certainly a best practice to separate those functions and have two different staff people so that the case manager is not collecting the rent or enforcing the lease, but rather is a support to help the person meet the lease obligations. So also we need that engagement of landlords and partners on that as well. So a few more core practices. I've already mentioned the idea about choice and helping people connect up with affordable housing, and that being a big part of the process and the work when people are homeless is really getting a sense of what they're looking for. In Housing First programs, the housing is as integrated into the community as possible. I've talked about the separation of housing and services roles. And that the lease agreement or an occupancy agreement really drives our services. So as a staff person, I'm talking to the person about the lease, educating them about the lease, checking in on how they're doing. Did you pay your rent on time? Have you been having any trouble with your neighbors? And then services that are provided help the person to meet the lease. So if a person really can't clean their unit, maybe they need some help with home health aid. Or if a person doesn't pay their rent because they spend it on other things every month, which we all have competing demands, and poor people have an even greater competition, maybe rep payee or direct vendor or direct deposit of a check might help with lease compliance. But our services are really focused on helping people be a good tenant, learn tenancy skills, and follow that lease. But we're also connecting people to services, and that, and I think this is a big lesson for the homeless system, is the homeless system can't do everything. Connecting people to treatment and community-based services beyond the homeless system is a big part of the pre- and post-work as we move people into housing, and especially national supports, and thinking about who are the other supports in the person's or the household's life? Are there good supports and positive supports, and how can we reinforce those supports? I think what we know, when we look at the evidence is who becomes homeless is people who run out of supports and run out of people to rely on, and in our own lives that's true. So we want to really focus on that. And we also want to think about working as a team in Housing First, having some supervision and resources. Doing this work means new skills, new information. It's a creative process, even though we can say it's an evidence-based practice, which means it's got some key elements and practices to define it. It's still creative work and a complicated work. And some of the folks we're working with have really complex needs. And I think in the homeless system we tend to do it on the cheap for folks, but we really do need some supervision, support, training, and resources. I think I've covered all of these key elements. I like to just call them out about using harm reduction, the assertive landlord, property management relationship and coordination, the expectations, and eviction prevention. And I really haven't used that term, but when we think about people being in housing, we want to think about preventing eviction as also one of the services that we're providing. So to sum up, kind of the big picture here, I've mentioned assertive engagement. We want to think about how to motivate people, what motivates people, what they're interested in, what their goals are, what they want next in life after homelessness. We want to do good assessments and housing planning, and I'll talk more about that. I mentioned Housing First is recovery-oriented, but I didn't really emphasize it enough. Recovery-oriented really means it's person-centered. It's driven by lining up housing and how housing helps the person to achieve their own personal goals. And our work being mainly focused on housing access, but also really connecting in and reminding the person frequently about how it does work with whatever is important to them, whether that be family, friends, a safe place to sleep at night, a place to be warm and dry, which we hear from people all the time. We want to connect into those goals. Services in a Housing First environment mean going out in the community, mean working with collaboratives and collateral agencies, mean helping people go to appointments sometimes, taking them to apply for benefits or maybe their birth certificate, but also once people are in housing, making sure we're in the home on some sort of regular basis so we can, not be walking in on 10,000 cigarette butts and burn marks on the couch. So it's really a field-based service, and I think for some programs that can be a transition from being used to working on a program level to going out with people, but we do know that that improves outcomes. People don't often need us to model and show them how to negotiate for services and how to do things in order to succeed. There's a lot of building skills here and building skills through modeling. And then linking to supports, not just treatment, but social supports, spiritual supports, libraries, sports, arts, recreation, other roles, and helping people connect to roles beyond being a homeless person, but having engagement and activity that's meaningful in the community and a community of support, and building that out, as well as, of course, services being individualized. So that's a basic overview of the Housing First model and practices that really apply to everything. And now I'm going to talk a little bit and go a little bit into details on the different phases of work and how we can be Housing First in those. I want to start by thinking about the homeless system as a crisis response system, and I kind of previewed that earlier. And that's really the language I think we're trying to shift the system, is to think about the homeless system is not a system that people stay in for 2 years or 3 years before they finally get a permanent place, but it's a crisis response system and works much the way that, again, an ER does in getting people immediately out of their homeless crisis and into a situation where they can address the root causes of it and other things in a stable environment. So getting quick access to shelter for people who need it, and then rapidly rehousing people. And there's a term, and some vision going around from the National Alliance about making homelessness rare, meaning, we do a lot at the front door to prevent people from coming into the system or divert them, and permanently, not diverting them just for a few days. Brief, that homelessness is, the episode is as short as possible, and being in shelter or transitional housing is considered still being homeless, as well as, of course, living outside. And so making that period of time as brief as possible, and non-recurring, helping folks connect to a permanent situation and resources that are going to help them maintain stability in the future. So rare, brief, and non-recurring is our goal as we move forward. So what does a Housing First crisis response system look like? I want to just go to the slide ahead first, and then I'll come back if I can. Sorry. Here's a diagram, and I think it's better to start here with a picture, albeit a little bit hard to read, and I'm sorry about that. But this comes out of the United States, USIC, it's sometimes called, the United States Interagency Council on Homelessness, which is a group of about 20 agencies that provide resources and services to help implement a plan to end homelessness, a federal plan to end homelessness. And this is the diagram of what the system should look like. And I think one of the big shifts with Housing First is it is a systemic approach. It's not just a program approach. And really thinking about what does our system have and need, and what's my role no matter where I am. And so we see on the left a coordinated entry system, and this is a family example, but the same thing could be really a little different diagram for singles in terms of the proportions, but very similar elements. We've got a coordinated entry system. We've got some targeted prevention and diversion, which is the top box in the second column for people, so that we try to divert people from homelessness whenever we can, that we have temporary shelter and crisis stabilization for folks, that we have multiple paths out, and you can see all these lines are different paths out of the system, and people leave the system bypassing the shelter stay, and we're seeing increasingly about 25% of households can do that. The household makes their own arrangements, or self-resolving as they call it. We know that can be as much as 40 to 50% of people in communities. Or people need a system response of rapid rehousing, and these boxes are kind of proportional to the size of the system we need. It's usually bigger in rapid rehousing. And some subset of people need transitional housing with services, maybe people who have had higher needs or in a transitional life stage, and I'll talk about that more. And then we've got a system of community-based housing at the end. That includes basically people finding their own place, living with family and friends, and decent accommodations, not overcrowded, community-based supports, and then for a small subset of households will need a permanent supportive housing. So that's what we want to think about as we think about our system, is not only what's here, what role do we play, and where are we in the process, but this whole thing is the goal is housing. So when we think about what does that picture really translate to, it means a few things in terms of our practice, that we're trying to prevent and end homelessness as quickly as possible, that we have the low barrier admission to programs and a rapid exit or rapid access to permanent housing. That we start talking about housing as soon as a person requests shelter by attempting diversion, but if not, as soon as people move into shelter or transitional or any other service, that we're starting to develop a housing stabilization plan and focus on our work. In a Housing First system, as you saw in the picture, services are targeted to the highest barriers, so that that permanent supportive housing box was small, but the coordinated entry system would help us target our resources based on need. A good system increasingly also is understood by people and informs and empowers the consumer, uses standards that are based on evidence-based practices. We know what works. We know what the results are. We know that things have changed over the last 30 years in terms of where we get the best bang from our buck. I think about rapid rehousing as an example, but also even permanent supportive housing, which replaced, in Housing First, replaced long shelter stays for people, getting them housing ready and moved them into housing. And then also we want to make sure our system is diverting, housing location. We're doing retention and eviction prevention, and also that we're doing a continuous quality improvement process, that we're looking at how's it working. There isn't really a recipe you can take off the shelf and say we need X amount of this and Y amount of that to make our system right, but that really means taking a look at everything on an ongoing basis. So some themes, just as we're doing our practice with folks, we're thinking about building their skills and helping teach skills, helping change expectations for people about what they can and can't do in their lives, believing that they can succeed in housing is a big part of that service, and helping people move away from crisis-driven lives, another part of the key part of Housing First, and really anticipating crises that have happened before and working to prevent them through the use of supports. It's also about assuming new roles and helping people transition from being a homeless person to not being a homeless person or a family living inside, but an independent person in the community, a tenant, an artist, a brother, a sister, an advocate, a peer. Find very often people want to give back when they go back in the communities, and also about helping people pursue their goals and seeing housing stability being tied to those goals. So now just getting into the program models a little bit in terms of Housing First and emergency shelter and some kind of crisis beds, which people are increasingly using the language of crisis beds or crisis housing, again, to try and change up our ideas about how it works and what it's about. And shelters increasingly in the best practices, there's a focus on permanent housing. They're low barrier. People are screened in based on behavioral criteria. This does not mean serving people who are unsafe to themselves or others, but it means removing barriers that don't necessarily relate to that safety, like requirements like that you have completed a program or have, sobriety requirements or have income to get into the programs or things like that. Believe it or not, there are shelters that require income to enter, which doesn't make too much sense. Increasingly also really building into your system year-round accessible shelters. In a lot of communities is a very small number of year-round beds for certain populations, and they may only have seasonal or winter shelters, and they see a lot of churning in that population. So thinking about year-round accessible shelter focused on housing placement and housing access for folks, and being able to work with people on a solid plan. Also, shelters are linked to coordinated entry, and there's some thinking about how people are connecting into the system, and shelter may or may not be the front door in your community, so it may need to build out that connection, and as well, obviously building in connections to street outreach. Very often, and it's surprising, street outreach and shelter are not connected, and so people on the streets never get shelter beds, and they probably should have some even level of priority for shelter beds. So what does that mean in terms of practice? Mandatory or arbitrary length of stay is something we recommend against because if you say our length of stay is 30 days or 60 days or 90 days, that becomes a given as opposed to really thinking about the goal being to decrease length of stay and secure housing as quickly as possible, and the goal for length of stay being as short as possibly can be. And obviously not kicking people out if they're not getting a housing plan, but really moving away from or moving towards thinking about that as an important goal. Focusing on housing planning, housing location, and document preparation. There's a lot of paperwork to get into housing. You definitely need birth certificates or ID. And I know a lot of shelters aren't really set up to provide this level of service, and I think that's a systems question. It's not just your shelter's problem, but if you want to be a Housing First system, how does your shelter have enough resources or your system so that you can do this work with people, as well as the next bullet on increasing income and benefits and connecting people to employment programs, connecting people to benefits. In many cases, communities had to really beef up the services they're providing in shelter to be a Housing First program. When we think about transitional housing, how does transitional housing can fit in a housing first system, and what is its role, and how does it work? We're thinking about, again, removing barriers to entry, like you've completed a program, like you have income. That's absolutely not a really good reason to screen someone out. Immediate development of a permanent housing plan, again, shortening the length of stay. I don't want to be too overly focused on outcomes, but one of the things every community is being measured on in terms of its competitive awards from the federal government is how long people are staying homeless. So it's a metric we're all being measured on, and the time in transitional housing is included, and it certainly has also been best practice for transitional housing to not keep people any longer than they need to, and to think about the quickest exit, a good solid exit plan as possible. Again, focusing on increasing income even more so than the shelters, because there's generally more resources as well as benefits. In terms of how Housing First is working in systems, in terms of its role, in some cases it's serving people who are higher barrier, maybe people who have returned multiple times to the system, or really maybe need some kind of a stabilization bed for a little while before they can go into permanent housing. I mentioned targeting people in a life stage transition, youth, young adults 18 to 24, substance users who are in early recovery or want services. There's been some guidance on recovery housing for people who are substance users using Housing First that HUD's put out, and there are lots of examples around the country of really taking people at the moment that they decide they want to be sober and working around that, and that's really a needed service we certainly need in our communities. And again, like shelter, not having a predetermined length of stay, even though funding requirements may say you can stay 120 days, they could stay 2 years, depending on the funding source, that should be basically based on the participants' needs. All right, so now kind of moving through, what are the jobs of staff and what are the roles of staff in the system, in a Housing First system? And tasks for pre-housing, as I said, there's a lot of work to be done with folks, and we can't shortchange ourselves in funding that service. I know some people have been struggling for getting this work done because the shelters are bare bones or coordinated entry doesn't have a lot of funding, and some of this pre-housing work might be able to be funded through rapid rehousing work as part of the outreach to bring people into the program. It may be able to be done by shelter teams or transitional housing teams. Some communities are looking at dedicated teams for this, but there's certainly enough work to go around. So obviously outreach and engagement is the important part here, is engaging people in a housing plan, making sure folks understand the role of staff, and this is really true at every phase of the work in Housing First. What is my role? My role now is to help you access housing. Once you're in housing, my role is to help you maintain it, to follow the lease, to be a good tenant, and to move on with your life. Really being clear about role is such an important thing. We want to understand housing and homeless history, and I'm going to go a little deeper in that in a little bit. While we don't want to delay housing for people, and we want to certainly move people out of shelter as quickly as possible, if we are going to be looking and working with them for a longer term, we really want to understand both where they've lived and successful housing history as well as their homeless history. We want to understand goals and preferences. What do people want? We want to help people understand what their options are and what the expectations are. So if you go to this rapid rehousing program, this is what you can expect. If you're in this permanent supportive housing program, this is what you can expect. But we also want to talk to people who might not have those options, because not everyone's going to get a response from the system on other options for themselves. Is it an option for you to live with other people? Is it an option for you to live with extended family? Is there a friend that you want to live with? Can you make it on your own? If you make it on your own, how much money do you have? Those are part of the housing options as well, because most systems and most communities don't have housing for everybody. So we also want to start the housing stabilization plan. We tend to suggest using this term for the service plan instead of a service plan, calling it a housing stabilization plan, just to really reinforce that's what we're working on, our housing access plan with people. And so that's a written document. It includes the consumers or the client's goals and what the housing plan is. And especially in the pre-housing phase, this plan is updated frequently, at least every couple of weeks, to really keep people moving. In pre-housing, we can also start teaching tenancy skills, reviewing lease obligations. We do a lot of consumer focus groups, and consumers consistently say that it's helpful for them to get those classes. Again, many people have never had their own lease. Sometimes you can bring in lawyers to do classes on that, your legal aid. You might have your housing department. You might have landlords come in, but to teach those tenancy skills. Of course, again, and I keep reinforcing this, if benefits and income, but if people have no money, even if you might be able to get them into housing, people need money to survive. They need money for other things, and really working on that angle, which I think is something in the homeless world, when we look at our outcomes, I think that's where we tend to see that we haven't been as successful as we have with things like permanent housing retention, for example. Excuse me. Other documents in the pre-housing phases includes getting all the paperwork together that people need to apply. We recommend helping people get an email address and a plastic accordion folder to keep all their paperwork in. Starting to connect to resources and supports. We don't want to wait till people are in housing to see who their supports are. We want to understand that up front, and we want to start making those connections. Help people prepare for the transition, complete the process, find a unit, housing search, which is a key part. And people are sometimes held up because they're really expected to do the housing search on their own. And it's certainly an emerging best practice to have housing location as part of your system somewhere. That could be located in each agency, could be on your team to have a housing locator, could be developed for the system to have a housing locator like they have in Cleveland, but that's a key part of it, as well as helping people get set up, because an empty apartment is not a home. And we see this a lot with Housing First. People are rushed to get into a unit. They get a unit, they don't even have a bed to sleep on, and they don't know anything about the neighborhood or have any amenities, and they end up leaving because they haven't really established any equity in that home and they don't feel connected to it. So that's just as important in the transition. To do all this work, staff needs some basic knowledge and skills, and understanding the basics of landlord-tenant law for your jurisdiction, in this case the state of Pennsylvania. You don't have to be an expert, but certainly enough to help connect people to that information and explain some basics to people, understanding the application processes, what the apartment standards are, how coordinated entry plays in, and also how to negotiate with people around preferences. So those are important things for anybody doing this work. Just a couple of seconds on understanding needs and preferences. I know we're trying to rapidly exit people from homelessness and into housing, but I've seen more than one really great housing plan go bad because we didn't really have any sense of what needs were or preferences, and a conversation about where people were compromising, which happens in most cases. None of us, unless we're really rich, usually get everything we want in terms of housing. But having some focused conversations about this and making sure we understand what's most meaningful to people in terms of do they need to be close to people and supports. A lot of people die of loneliness when they get out of the system, and so that is an important thing to think about. To also think about pets, because that keeps a lot of folks homeless. And using, maybe people need a reasonable accommodation to live with their pets, but not assuming that people have to give up their pets. But really having a sense of what's ideal for people, what's negotiable, and what's not negotiable as we understand preferences. This tool, which is actually embedded in the previous slide, it's a Word document, is something you can use. You can modify it for yourself, is sit down and have an understanding of what people are looking for in housing. And it has 3 columns: my status, where am I now, my ideal, what's my dream, and what I would accept. And we get a sense of where people really will compromise, which they're going to have to, where they say they won't, and if they do, that they're knowingly compromising and maybe thinking about, well, maybe I can't get my ideal right now, and that is kind of non-negotiable, but trying to link this first housing option into them achieving their longer-term housing goals. Because for a lot of folks, not having a landlord reference, not having a history as a tenant means they have less options. And so making sure that's a part of this conversation with folks. Well, I know you really want to live in this, this particular neighborhood. We really don't have any landlords because of your background. Now, we're not going to impose that, but a lot of landlords might impose something around criminal background. And if that person had another landlord reference, they might be able to move into that community. So just a quick example. No, I'm talking fast, but a lot of information. I mentioned this housing homelessness history. This just kind of details it a little further about what we want to know when we're understanding that. And these should be conversations with people. This is, you can do it in an assessment and sit down and kind of rapid fire questions to people. But, we're assuming people are having a case management relationship with people, are working with people on a regular basis to both assess and plan with them and move towards a housing stability plan. And then once they're housed, that there's continued work on housing stability. So we want to know where people lived, again, what their roles were, what worked for them, what didn't. We also want to know what's caused people to become homeless. And that's a hard conversation. It's not as fun as talking about other things like baseball or whatever. But what we know is that the thing the best predictor of the future is the past, and having an understanding of where people were, why they lost their housing to begin with, will help us put in place the right services and supports going forward. Excuse me. So if a person didn't pay their rent, again, because they had competing demands like things for their kids or maybe gambling or maybe, lots of bills, medical bills, that we want to make sure we attend to how they're going to get the rent paid. If they got into a lot of conflicts with people, we're going to want to make sure we think about that both in housing location. Maybe if a person cuts in a lot of conflicts, we shouldn't find them a unit in a place that has a lot of social interaction, et cetera. But really thinking about that from the get-go as we're planning with people, that we put in place a plan to address any of those issues that are going to come up post-housing. If they don't have enough income, obviously we're talking about helping them connect with more money. So we're also, as a part of our work at all places in a Housing First system, making sure we're connecting people to community resources, how to get them, what the processes are. And as I mentioned before, and I want to really reinforce this point, helping people to connect to services. A referral does not mean a linkage is made. And we may need to help people learn how to manage their needs in the community and learn how to assert their needs when they go to a clinic or an appointment, how to tolerate wait times, which is unfortunately all too true for our population, and also negotiate for services. And if we can build that skill building, that can be done by peers, that can be done by housing locators. This would even go for housing options. We want to accompany people and give them a lot of support. This slide is just to remember to teach people lease obligations. We use this slide in tenancy classes that we ran just because looking at a lease is a very dense document, and for a lot of folks with literacy issues, it may not be it's important that we review the lease with them, but it may not be that meaningful or easy to understand. I know I looked at leases that I couldn't understand. Might as well have been in a different language. But I think really reinforcing what the requirements are, making sure staff knows this, again, pre-housing and post, that we want to go over this lease obligations and make sure people understand our role is there to help them, support them do this. And these are the most common things we like to highlight in terms of people's expectations. Let's see, my time is kind of flying, and we'll leave a little time for questions. So one of the things we want to do also is, as I mentioned earlier, use the lease to structure our services and teach people how to meet their tenancy obligations, work with landlords, but be separate, or work with our service if we're a service provider or permanent supportive housing provider, make sure we have someone who functions as a property management role. And this is really to teach people how they're going to live in the community. I mean, if you're out renting an apartment in a community and we want everybody the opportunity to have life after case management or life after the homeless system, is really preparing people for the reality, which is their landlord is not their priest or rabbi or imam, and not creating an alternate reality. And then very often, sometimes we are struggling to engage people in services, but they may be willing to use services in order to keep housing. So someone may not really see that they need to maybe reduce their drinking or drug use for their health. It may not be a motivator, but because the level of use is causing them to spend so much money and their housing is at risk, that may motivate a person to think about harm reduction or think about abstinence as a way to keep their housing if it's important enough, or maybe a relationship that is important in keeping up in that housing, and the person may be willing to engage in some services in order to keep their housing, or that person really does have trouble managing their funds, but they really can't, and a landlord could sort of say, well, in order to maintain his housing, you really need to have direct vendor or rep payee, and so the landlord could kind of be the heavy and make that stipulation, and the person may be willing to accept that to keep their housing. So we always want to be looking to how, the issues that people have may be threatening their housing or threatening their achievement of other goals. So that's a really important connection. So we really mentioned the landlord property managers as our partner, and it's so important that we have a slide about it, making sure that people are establishing tenancy obligations and enforcing them. We hear a lot that landlords call the case manager and say, can you fix this? And what's really important is for landlords and property managers to make sure people are given notices when they violate their lease obligations, and that there's a process to cure that, to resolve those problems, and also that we're there to work with them and help the person manage that. And that's really important once people are in permanent housing, is figuring out how that's going to happen. If your services are time limited, well, you can do that for a little while. If your service is permanent supportive housing, and you can do that for the long term. But what if your temporary services? Who's going to help people manage this? Post-housing is an important thing to think about. But while we're working with people, we want to really reach out proactively to landlords. Our recommendation is to reach out monthly and check in. So if you're doing rapid rehousing, at least every month you would check in with the landlord with the client's permission. Again, teaching that eviction prevention mindset, and having an understanding of how the landlord works. Some of us are working with landlords who've got large numbers of properties and maybe are for-profit, might be small mom and pops, it might be a nonprofit permanent supportive housing program. So we need to know those different processes. We also need to visit the home often, and especially in the first 3 to 6 months, we really want to be there in at least once a month, if not more frequently, and then also talk with the person about anything that's going on. Have they had any conflicts with their neighbors? How's it going with the landlord? Did they ever see the landlord? How is it going with the money, to really prompt that? Or if we see piles are accumulating, we make sure the person understands what the expectations are for access to the unit and a clear pathway, so that's the focus of our visits and our conversations. Few harm reduction, eviction prevention strategies, just some examples. I've already mentioned rep payee only maybe 47 times in 49 minutes. Automated rent payments, again, this could be voluntarily. Landlords could stipulate this. Sometimes landlords stipulate this when people first move in. Sometimes landlords or property managers will stipulate this if people are falling behind. But it's number one because that's where people tend to get in trouble. Another place people tend to get in trouble is maybe with disturbing their neighbors, and really thinking about how people can have fun without disturbing their neighbors. Things like carpets and drapes, air purifiers and fans can also address other nuisance kind of behaviors. Headphones, people like to listen to music loud at night. We also have some folks, and increasingly among our population, people who may have organic conditions, dementia, Alzheimer's, or brain injuries. Certainly a lot of homeless folks have brain injuries and may need other things like safety shutoffs on the stove or the hot water so people don't scald themselves. Thinking about substance use differently, helping people and walking them through how do you use less. So, and this can be controversial for programs, but you're spending $250 a week on crack. How can we get you down to $75 because that's what you can really afford? And I know for some programs it may be a radical kind of conversation to have. It's certainly been a helpful conversation to have, and people, as a step towards abstinence, a lot of times they change their behavior and they change their use. And so any change in use could potentially be a step towards bigger changes in that. And practicing how to have those conversations without maybe being judgmental or angry or laughing sometimes is an important skill to have. Even talking about, changing what alcohol a person uses, from hard liquor to wine or beer, or drinking soft drinks in between their use, or and really that's our very big harm reduction strategy, especially when we think about our chronically homeless folks who are going to oftentimes become homeless again unless there's some change in that relationship. Although, again, that rep payee really helps. Help people budget for their recreation. When we're doing budgets with people, not assume that every penny they have is going to go to necessities. So if you need more money, how can we help you get more money? And that's really an opportunity to have the conversation with people about connecting them to benefits and employment. I already mentioned homemaker services. Some people may need assistance and may be eligible for assistance, especially as we see our aging population, or maybe even for a live-in aid is a reasonable accommodation. Keeping people having something to do is a really important part of it, and engaging in some kind of meaningful activity. And then finally, finding another unit and having the landlord agree to the lease with no eviction. And that's a no harm, no foul kind of situation, so people don't get another eviction on their record. But we don't really just want to keep rehousing people, and I think this has been a problem that people have seen is that people are burning out sometimes in their units, and, well, we'll just rehouse you. But if we don't really use that as an opportunity to put a plan in place to say, okay, so this is what happened last time, and this is what we're going to do to prevent that from happening again, then we're really setting the person up for failure and providing the appropriate services. Sometimes this also means maybe that a person needs a different level of service than what they've had. So they've been in rapid rehousing, but maybe they really need a long-term permanent subsidy, or maybe they need a permanent supportive housing unit. So we don't want to just say, okay, we'll just move you. It looks like I might be having trouble with this, but I will let you know in terms of the presentation. I only have 2 more slides to go. Oh, we're okay. So the last couple slides relate to this harm reduction idea. And here's a sample plan, and I think people have found this helpful as a way to have difficult conversations with people around things that are going on in their housing. And the far left corner talks about the risk, which is the person is possibly going to be evicted because they have friends in their apartment and they're disturbing their neighbors. And then this chart would be blank when you sat down with someone, but to really sit down and have a conversation about what this risk is, what the options are to resolve the risk, so what, and really hearing what the person's ideas are first, and then evaluating those options and again, using their words first, we can maybe fill in later, but what are the factors in favor of this, what are the factors against this option, and what at the end of the day is non-negotiable, either from the landlord or the tenant's perspective. And so here we have disturbing the neighbor. Well, maybe you could go to your friend's house. Maybe you could find another place to socialize that's less disruptive to the neighborhood. Well, let's talk those through. And so that people are engaged in a process where they are cognitively engaged in solving a problem that they're having where we are not in the role of figuring out the answers. If we were in a training session, we often have people sit down and do this for a person they're working with, a client they're working with. And I think starting with a blank slate, it's a very helpful tool. It puts things on paper for people, and also I think gives a good example of how we really are in Housing First, ultimately trying to help people be adults, live as adults, take charge of their lives, engage in a more reflective process on their lives, as well as seeing themselves as people who have succeeded, have skills, and actually can come up with their own solutions. Because if there is going to be life after us, that process needs to take place. And so I guess I'd like to kind of wrap this up with a question about whether you're a Housing First program or community, and having folks reflect on that question about whether your services in your program or your system are low demand. Whether rapid rehousing, whether the focus on permanent housing starts at the front door. That's a really key thing, no matter where you are in the system. Rapid rehousing happens rapidly. I think that's a little bit of a problem in some communities. Sometimes really it's about capacity. Sometimes it's about having housing locators, but that's a really key piece. Are your housing interventions low demand? Do you have requirements that are above and beyond basic, safety and behavioral requirements? Are we screening in and not out? I think, when we think about making homelessness rare, brief, and non-recurring, that means we have to serve all homeless populations. And in the past, we could screen people out because we couldn't work with them, but then they're just going to show up as a return. They're going to show up as a long-term stayer, and they're also not going to be served. And I think where we want to go is think about why couldn't we serve them, and how can we, in fact, serve this population. And then finally, in our system, is our permanent supportive housing targeted to the people with the most intensive needs? So that's just a question for your reflection. And now we have like 3 minutes left. And I don't know if there's been questions come in. I'm sorry, I've just been busy talking. Any questions? No.
Thanks, Suzanne. I appreciate it. I think just because we have a couple minutes left, can people follow up with you? Is there a way for people to email you or get in contact with you?
Sure.
If they have follow-up questions.
Sure. My email's on the first slide, and so people will have that. And if there aren't any questions, I don't see anything coming up. I guess I will.
I do.
Oh, okay, because I was going to do my last slide, but I will go back.
I just have one quick question. Can you hear me?
Sure, yep.
Yes, yep.
It's Joyce. I couldn't help myself. Thanks, Suzanne. That was great. I come from working in a shelter in the early, 90s into 2000, and, had a mindset that people had to be clean and sober, like, immediately. So I think for some, I've traveled around the state, rural, suburban parts of Pennsylvania, sometimes getting over that, like you had mentioned, buying less crack, for the folks out there who have to kind of wrap their head around sort of thinking differently than they have maybe most of their careers. Do you have any thought or any, with me, I just had to get over it, and I'm a believer now. So, but for folks who aren't quite there, I didn't know if you had any thought or.
Yeah, I guess I like to use the diabetic example. I think I think it's partially related to what we've been told and how our programs have operated and what we ultimately know is best for people, right? We ultimately know that's best for people, and it's so hard to see people do something that's not the best thing for them, but this is better than what they're doing. Right, and so like with a diabetic, if they weren't willing to completely, change their diet and take insulin, but they were willing to do some of that or one of those things, would we say, well, sorry, we can't help you with that unless you're going to do the whole thing whole hog, right? And so it's a step towards sobriety, and I think, anybody, I think using the metaphor of other addictions, anybody who's been addicted to sugar or cigarettes like myself, knows that when you try to change an addictive behavior, it's a process of change usually. Yes, there is that point at which there's a hard stop, but you don't get the hard stop without changing your relationship to whatever that substance is and starting to relate to it and think about it differently. And having those conversations, and I remember when I first started doing that work, it was such a relief to not be the cop anymore, but to really talk to the person about what it was like to give things up or drink less or drug less. I felt like I could be so much more helpful. But it was scary and hard at first to make that transition, but then it really became much more doable, and I felt much more empowered as a worker because I could really talk to the person about what was working for them and saw people go from reducing use to stopping use.
Thanks. That's really helpful.
It's the recovery thing of walking alongside of somebody. I wanted to put that out. I know we might have some mental health people on the call.
Gotcha. Thank you.
Great. Thank you so much. So I do see that we are out of time. I see that Vince has a question. Vince, if you could maybe follow up with Suzanne after the presentation, that would be great. So we're going to end today's presentation. Thank you so much for coming out. Appreciate it. And thank you so much, Suzanne, for presenting with us today.
Thank you. Have a good weekend, everyone.
Thank you.
Bye.